Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. The British government just dropped a bombshell in the policy battle over the most effective way to end smoking. Health Minister Neil O'Brien announced an astonishing new plan. The government will provide 1 million smokers with a free vaping starter kit to help smokers kick the habit. The Swap to Stop program is a world first, and it couldn't come at a more opportune time. Anti-vaping campaigners in the UK have made surprising headway over the past 12 months by hyping concerns over flavors, illicit disposables, and of course, a so-called epidemic of teen vaping. Joining us today to talk through the impact of this astonishing new plan is Clive Bates, tobacco control policy expert and former director of Action on Smoking and Health UK. Clive, thanks for coming back on the show.
Always a pleasure, Brent. Glad to be here.
Well, how big of the news is this news about 1 million free vapes?
Well, I think it's big news. It's a massive endorsement by a big government of vaping as a harm reduction strategy. The thinking behind it is that the people who need this, the initial starter kits, are going to be the poorer people, the people who suffer forms of disadvantage, who basically just need to get themselves over the hurdle of starting. It's not the government paying for people to vape indefinitely. It's just doing enough to get them started. Now, if you think about it, if you don't know what it's going to be like, you're strapped for money, you're struggling to make ends meet, you don't know whether you're going to like it, you don't know how to get started. That's a pretty big barrier to jumping over to vaping. If you can jump over, you save money, your health is better, you probably feel better about yourself because you're not excluded and you're not putting up with all the stigma and everything. So that's the idea. It's designed to be catalytic to, trip people from smoking into vaping, and then people would be self-sustaining in vaping once it's switched.
Now, is it also designed to address some of the misperceptions that are prevalent in the media with regard to vaping?
Well, I think the biggest factor in addressing misperceptions is that however you look at it, it's a massive endorsement of vaping by a major government. So, it doesn't, yes, they'll give the National Health Service in Britain already gives out sensible, reasonable, proportionate advice on vaping. We have Public Health England and its successor give reasonable information, they compile evidence and so on. But you can't beat a government basically saying, yes, we back this as the alternative to smoking. I mean, everything else is detail and noise. The big communication is we're doing this because we think it's good. And that's what people will take away from this. The government thinks this is a good thing to do as an alternative to smoking. Otherwise, they wouldn't be providing 1 million starter kits.
Now, from what I understand, it's almost 1 in 5 of all smokers in England that will be provided these kits, and there's behavioral support as well.
That's the idea. The idea is to tie up a pragmatic, constructive intervention on technology, in other words, get people started, with the behavioral support that you get from the stop smoking services that we have in Britain. What I'm hoping is that the government is fairly open about this and leaves lots of room for creativity so that some of these services will link up with vape shops, because there's a whole huge amount of expertise in the vape shops. If you want to learn how to vape and you want to get exactly the right vaping product for you, the place you go is not a hospital, not a doctor, but a vape shop. They'll see you right. They'll know how to adjust the flavors, the strength, what devices work, and so on. And those shops, when we think of them as shops selling vapes, but they're not. They're a kind of community-based service in which they help people find the product that they want. So it's a mixture of selling a product and providing a service. So what we want to see is some imagination going on there in the way this is delivered, so that people form a relationship with a vape shop that helps them get the right products and the right kind of thing that works for them. And that will increase the chances that these are successful. And then the shops will then, be able to get people on an affordable package compared to smoking, which is incredibly expensive in Britain. 20 Marlboro would be costing, well, in pounds, it'd be about £12. That would be what, $15 US dollars, don't know in Canadian, but they're really expensive here. And people will save a ton of money if they make this switch. There's so many good things about it. Once the people switch, their health will improve, their welfare will improve, self-esteem will improve, and they'll have a lot more money on the table in the household budget. So the government's understood that this is a critical intervention, not only for health, but for health inequalities. It's designed to help the poorest people, and those are the people that suffer the burdens of smoking and the regressive burdens of tobacco taxation.
Now, you make a great point about the vape shops, and from what we've been told, it's going to be open system products that it's likely to be handed out by the government. So that makes a great logical connection to the vape shops.
Well, the government quite rightly is sensitive about single-use disposables and the waste problem and so on. What I hope is that they're not too prescriptive, and that actually they let people find what the thing that works is the thing that works for the person. There isn't a universal silver bullet in vaping or smoke-free products that works for everybody and is just like the best thing, or that's what everyone would be buying. People have different tastes, they have different needs at different times. They may have different products that they want at different points in their journey away from smoking. They may be a concurrent user for some time and then gradually taper down their smoking and taper up their vape. Everybody does it in a different way. So the key thing, I think, is that the government shouldn't be too prescriptive. It should follow what works for people, and they should be able to explore that with the professional help that we have in the NHS and the stop smoking services, and if you like, the service element of what goes on in vape shops. That's the way this will work best.
It's amazing. Taking 20% of all current smokers and putting a vape starter kit in their hand. Yeah. That's a huge shot in the arm.
Well, yeah, I mean, obviously it's a brilliant thing to do. And if you could just get to the poorest 20% of smokers, I mean, it's not that easy to do. You have to get people, you can't make them do it. You have to get people to want it, to want to try it, to experiment. I have to say, it doesn't work for everybody. There are people who try vaping and say, well, thank you very much, but I'll carry on with smoking. So it will be successful, but it won't be, it won't be like a one-off, total wipeout of smoking. But it will make a difference, and what it will do, I think, is it will normalize vaping in poorer communities where at the moment smoking rates can be very high indeed. In some of the poorest places, you see smoking rates up around 70% in the most disadvantaged communities, very isolated pockets, or particular groups, people with mental health problems, homeless, prisoners, sort of thing. Very, very high levels of smoking. If you can get into those groups and normalize vaping or something as an alternative, those people won't just be quitting and saying, well, that's it, I'm just going to use a nicotine patch and quit. But if you can find a different way for them to take nicotine, saves them money and still works for them, game on. Massive, massive win for health and in terms of health disparities.
Clive, they're also focusing, the government is, on helping pregnant women. What's the plan there?
Well, I mean, there's been and I can't remember exact name, but I think it's some kind of pregnancy and tobacco advisory group in the UK that's been working away at these issues for years. I mean, they have had, people like Linda Bald and so on have had this sustained effort to put the concept together of a harm reduction approach for smoking in pregnancy, and to work out what instruments would make it work. And they've piloted this voucher scheme and so on, and it seems to work, and they're going to now roll it out at scale. It's good public health strategy. It's the right way of doing things, and that's what they're going to do. I mean, of course, people say, well, no one should smoke or do anything during shouldn't smoke, drink, shouldn't have any fun or do anything. But reality-based approach to this says that, you might want women, to quit everything completely, but life tells us that just doesn't happen. The pressures on people are such, and the stresses that they feel are such, that many just continue to smoke through pregnancy partly as a coping mechanism, partly because it's what they're used to, partly because the drugs are dependence forming, and so on. So the question is, what can you do that will help people not necessarily eliminate the risk, but reduce it? Because just saying, well, you must quit and here's some patches, doesn't seem to work that well. So there's been more imagination has gone into this. What are the incentive structures you can use to get women to focus on this? And what are the interventions you can use to help them get away from smoking? And it's a great program. Let's see what happens. I know it will be evaluated very carefully. It's going to scale now, so hopefully other countries will be able to learn from it. If we make any mistakes, then they'll be able to learn from those, and if we get success, they'll be able to learn from that.
Now, and to be clear, that there for some time during this research and in other programs, some pregnant women in the UK have been getting e-cigarettes for treatment for smoking.
Yeah. No, they've been pretty clear, which is, a lot of people say, well, you shouldn't have any sort of nicotine at all. But that is an unhelpful message if it means that the woman goes, well, no one's helping me, I'm just going to smoke. So what it does, and this is at the heart of the British academic mindset and the professional mindset in Britain, is we don't accept that everyone will give up smoking just because we say they should. And frankly, we've been doing that since 1962, and we still have 1 in 6 of the population, around 1 in 7 of the population, adult population, smokes. So, and we've been saturated with information about how bad it is, how antisocial it is. People have had they've been taxed until the pips squeal. They've been hammered with restrictions, with plain packaging and everything, and we've still got 7 million smokers, 6-7 million smokers. So you can't wish the problem away. You have to find pragmatic ways to reduce the harm to those who will continue to smoke or use nicotine, whether we like it or not, and that includes pregnant women.
Clive, with this Swap to Stop program, and as well this track record of providing e-cigarettes to pregnant women, it strikes me that this is making a very, very important argument for the efficacy and, dare I say, safety of e-cigarettes.
I think implied in the government's approach to this is a strong statement in support of safety, relative harm relative to cigarettes, and the idea that these products ultimately displace smoking. I mean, those are the two things you need for harm reduction to work. The products must be much lower risk, and they must substitute or displace smoking. And that the fact that they're running this sort of program means the government in England has accepted that those two conditions are met, and therefore there is a public health harm reduction advantage to be had. And frankly, if you ignore it or you pretend that isn't the case, then you're actually adding to the harm implicitly. If you don't do these things, if you do know that vaping is much less risky and you know that it displaces smoking, and you still try and suppress it, what are you doing? You're adding to the total net harm, because you're not doing what you could do to exploit the value of these lower risk products. So I think that's where they are scientifically and ethically, that once you know this and you know how cost effective it is, then you have to do it.
Clive, we just had Louise Ross on the show. She's a clinical consultant with the UK's National Centre for Smoking Cessation and Training. And she told us that the government held this news very close to its chest, giving her only 24 hours notice. Was the announcement a surprise to you?
It was a surprise. It was a surprise and a delight. We had heard all kinds of ominous drum rolls. The usual anti-vaping suspects had been beating their chests about flavor bans, disposable bans, plain packaging for vapes, and all manner of things that would just basically do nothing except protect the cigarette trade, certainly wouldn't stop anyone smoking. So it was a great surprise, and it's great to get good news in this field because there's so much bad news most of the time, and they've done it in a very eye-catching way. There's another thing that I wasn't expecting that the New Nicotine Alliance had been pushing, and me too, which is the idea of putting inserts in cigarette packs that would encourage people to switch to vaping. So it's essentially using the cigarette pack as a promotional vehicle for vaping. That was another surprise. I mean, we've talked up that proposal, but I wasn't expecting them to do it. So that's also very good. They have said they want to consult on measures to reduce youth vaping, of course. But I think that gives us an argument, and the government here is receptive to this, that you have to be very careful with these measures. You can do things like ban flavors or disposable flavors, but you might end up with more smoking. Unintended consequences are the main consequences of doing these youth anti-vaping measures. And the danger is, in order to protect a few young people from messing around with vapes and not a particularly serious health risk, you end up subjecting adults to much greater health risks because you end up having more smoking and less vaping than you otherwise would have had.
I'd like to show you, Clive, this story. This was in the Sunday Times just about a couple of weeks ago. Vaping epidemic among teenagers prompts calls for regulation. Doctors warn almost all teenagers could be vaping in Britain in 5 years.
There's absolutely no basis for saying that. I mean, I'm sure a doctor popped up who knows nothing about the epidemiology or anything to do with any of this, popped up to say that, maybe put a ruler on a graph and said that, well, if you just project this forward, then everyone will be vaping. But that's not how it works. There's only a subset of the population who are interested in using nicotine, who want to use these products. There's no reason to think that everyone would be using these. There is a reason to think that more people will use them than would have smoked, for the simple reason that vaping is not really very dangerous. And the harms of smoking essentially amount to a deterrent to its use. The harms, the stigma, the taxation, the smell, the mess, all of that sort of thing have been increasingly a deterrent. Now, none of that comes with vaping. So it is possible that more people will want to vape than would have wanted to smoke. I mean, that's just sort of economics 101. The cost to the individual go down, you'd expect the use to go up. But it's not going to be an epidemic or a reason to panic. And even if you get more people smoking, we have to remember vaping just isn't very dangerous. And so I always think in terms, when I have a daughter now, and I think, well, what's my risk register for, a young girl? And I tell you what, vaping isn't really very high up on it. When you think of all the things that you would worry about as a parent, hard drugs, alcohol, texting while driving, mental health problems, bullying, some of the suicide-inducing stuff you see on the internet, the list of things to be anxious about is very long. If you're actually sensible about vaping, it's not something to worry about too much. I mean, that's not a popular public message, but that's the reality from a public health point of view is that compared to smoking, compared to illicit drug taking, compared to excessive alcohol use, compared to driving under the influence, texting while driving, all of these things are much, much more dangerous.
Now, you mentioned, Clive, that one of the developments of this program could be the normalization of vaping, yet it's exactly that tobacco control and anti-vaping campaigners have been trying to prevent for several years, is the normalization of vaping. So how have the campaigners reacted to the Swap to Stop program?
Well, they don't like it. They think abstinence is the way to go, and this is this is a kind of sinner's pathway in which more people will use the drug nicotine, and therefore we'll be a society enslaved to nicotine. But the key thing to understand here is that people like me and most of us in tobacco control or public health came into the tobacco control issue because of serious diseases. If you go back to the Surgeon General, the Royal College of Physicians, big reports in the 60s, it was all about cancer, cardiovascular disease, COPD, strokes, peripheral vascular disease, horrible, horrible things that cause people to die early and live in misery. And that's why we came in wanting to do something about smoking. Now, I, for one, I'm not particularly judgmental about drug use. If people, people drink alcohol, they take caffeine. Increasingly, we've normalized the use of cannabis. This is a relatively innocuous recreational drug. Very, very little in the way of side effects. People don't lose consciousness. They don't get violent. They don't lose their ability to drive a car. They don't have household breakdown or anything like that as a result of it. So we have to get used to thinking of this as something that's a bit more like taking caffeine or moderate alcohol consumption. And the fact that more people do it isn't necessarily a reason for us to lose our minds over it. The problem is there is a deep conflation between the drug nicotine and the harms associated with smoking. And those two are very, very blurred and mingled in the public consciousness. And therefore, people have seen nicotine as a sort of demon drug, where actually it isn't really.
Clive, on its face, this appears to be a monumental program. The question is, will it happen?
I think it will happen. The commitment is there. They've said they're going to do it. They put the money aside into the budget. It's a bold preventative measure. The minister that's behind it, Neil O'Brien, is well respected and capable, and I think will understand that there's a delivery challenge. Whether it'll work at the scale they have announced it at, that's a different question. That will always be about what the uptake is and what the level of interest is. But the commitment's there, and I think they really want it to work because it's a critical intervention on health inequalities. And if you look at where the political battlegrounds are in the United Kingdom, they are in these towns where people are living pretty rough lives. There's been a lot of unemployment, low paid work. People have been hit by inflation. So this is something they can do at low cost that plays well in these poorer communities in terms of two things: improving health and well-being, but also putting money on the table by saving some of the costs of smoking. They're not going to reduce tobacco taxes. So this is a way in which they can actually help people respond to those taxes, save some money, and put more food on the table because they're saving money. So it's actually a very well thought through intervention. Doesn't cost very much in terms of the benefits that you get from it. So I've always thought that this would be a very promising intervention that you can make work, that deals with the welfare of the poorest people. There's not many things you can say that about, to be honest. There aren't that many things that are easy and cheap to do, and this is one of them.
When it comes to tobacco control and public health, intervention is really the key. It's the moment where the theory, intersects in with the population and something happens. And quite frankly, when it comes to tobacco control, their interventions around vaping has been wagging fingers, demonizing, banning, smearing, misleading. And those are their interventions. This is the first real intervention I've seen from government that's got a shot at making a difference.
Yeah, I mean, there's a couple of things to say. I mean, the tobacco control business model is essentially we will inflict various forms of pain and discomfort on you as a smoker. We'll tax you, we'll restrict you, we'll apply stigma to you, we'll ban you from public places and all this. And our promise to you is that when you start doing what we tell you to do, which is to stop smoking, the pain will stop. Okay, so it's a very punitive, coercive model at its heart. Okay, now what this is saying, actually, there's a different way. We can help you do this with your consent. Okay, so in this model, we, the state, put ourselves on your side and become an enabler for a behavior change that will be beneficial to you in multiple ways. We're not going to just beat you into doing it. We're going to do it with you, and we're going to be there to help you rather than make you do it. And I think that's a much better model of public health, in my opinion. And I think we've pulled the applying pain levers. We've hit people with big sticks now for as much as we can. That we can't keep raising taxes. You can't keep excluding people. You can't keep stigmatizing them into a kind of submission and hope that they will go with you. They'll just defect. They'll go to the black market. They'll just walk away, and you'll have lost them. This is a much better way of doing public health, in my opinion. It's much more ethical. It's much more respectful. It's the smoker as a citizen and a voter, not a patient, to be treated and controlled. And that, I think, is a fundamental difference in philosophy here. There's been signs of this in England in the past. I mean, they've advertised vaping and they've been positive about it, and they've encouraged stop smoking services to become vaping friendly and so on. But this is on a whole different scale.
Now, let me first ask you about the U.S. Is there any hope that this program might crack through FDA and CTP and Campaign for Tobacco-Free Kids? I mean, Truth. Is this likely to have any difference in the U.S.?
I don't think the conditions are set up for this sort of thing in the US, to be honest. This hasn't come out of a clear blue sky, out of nowhere in England. The people behind this have been working with this mindset for years. The people at Public Health England, as it was, the academics at King's College, Queen Mary, UCL, and everyone, the people who are, if you like, the brains behind this have this philosophical approach that is quite deeply embedded. It's a very pragmatic style. We don't really see that in the United States. In fact, what we see is the opposite. We see, a billionaire money in huge quantities that flowing into health organizations to encourage them to create a very shrill, aggressive narrative that talks only about young people vaping, is largely indifferent to the actual at-risk population, which are middle-aged adult smokers. They're the people who are really at risk and suffer the harms if they don't switch or stop soon. Okay, and the distorting lens of all that money, all that ideology, all the research that's funded is primarily orientated to youth vaping issues now. I mean, that's what if you want to get a grant in the US, that's what you go for. the depth isn't there to get that sort of change of mindset in the United States. But what I'm hoping is that England will set a good example, which it already is, and that in the end, sensible governments, and I'm thinking Canada, that might be a surprise, but to me, they are a sensible, the potential there is for sensible policy. Policy has been changing in Canada in a good way. New Zealand, some of the European countries who think about these issues in a more compassionate and less ideological way, that are more pragmatic and want to get things done and achieve results with smokers and don't want to just beat them with sticks and talk about young people. That's what we need more of, really. But I don't see that starting in the United States.
Clive, last question. With all the work you've done over the years in support of safer nicotine products, and considering the amount of flack you've had to take from anti-vaping campaigners, does the UK's Swap to Stop program provide you any satisfaction or maybe even a sense of vindication?
Look, the thing I'm interested in is what it does for the 6-7 million smokers that we have in the UK. A lot of people are going to have a better and longer life for this, and that's what gives me satisfaction. I think it's a vindication of the harm reduction approach that me and frankly many others have been pushing in the UK and internationally. It's a recognition by a major government that tobacco harm reduction is an important public health strategy, that the risks and benefits play out in the right way, that the risks of vaping are much lower, that vaping substitutes for smoking, that people who switch will experience significant benefits. That's the important thing. It's an endorsement from a major government. What I'm hoping, because England's a relatively small jurisdiction worldwide, is that people in where the big smoking rates are in Vietnam, Malaysia, Indonesia, in South America, they pick up on this and go, hang on, there's something to see here. And that's what we need. We need something that disrupts this narrative that this is all about, just the tobacco industry and just hooking kids and all this. Not true. It's about doing something that will change the basic technology of nicotine use from something that's extremely dangerous to something that's relatively benign, with enormous health benefits that will run to, I think, over time, hundreds of millions of avoided premature deaths. It's a massive public health potential here. And I think this thing that's happened in England hopefully will start to kickstart that around the world and will give public health officials more confidence in that strategy and push back on some of the nonsense that they're getting from the WHO and some of these other grandstanding health officials that you see.